Hi, my name's Emily.
And my name's Emma.
The aim of this video is to demonstrate a number of exercises to help alleviate the discomfort caused by hip dysplasia in pregnancy.
We've adapted these exercises to maximise comfort and safety of you and your unborn baby.
As you are probably aware, hip dysplasia is a deformity in the hip socket which can cause your hip to wholly or partially dislocate.
This can cause chronic pain, which unfortunately pregnancy can make worse. As your baby grows, it puts increasing pressure on your hip joints, and the hormones produced in pregnancy can weaken your ligaments.
Gentle movement and stretching can help to lubricate these joints and relieve the discomfort of the pain.
We have adapted these exercises for pregnancy. However, we would recommend that before undertaking a new exercise regime, you consult your midwife, physiotherapist or other healthcare professional.
As little as 10 minutes of exercises a day can help improve the discomfort caused by hip dysplasia.
The first exercise we're going to demonstrate is bilateral leg extensions. Firstly, adopt a semi-recumbent position, which is lying down with several pillows or something to prop up your top half so that you are lying at this angle. If you weren't pregnant, you could do this lying totally flat. However, the weight of a baby bump can put pressure on your major blood vessels, causing you to feel unwell and faint. To begin, start with your legs out straight in front of you. Keeping your knees straight, extend your right leg out, then your left leg out, then your right, then your left. Notice how when your right leg is out, your left hip is pulled up towards your shoulder, and vice versa. Now combine with the following. When your leg is extended, turn your calf inwards. When your leg is pulled up, turn your calf outwards. Concentrate on your right leg first, then move on to your left. Do this for several minutes, or however long feels comfortable. This is helping to tone the muscles around your pelvis.
We are now going to demonstrate the second exercise, which is an add-on from the bilateral leg extensions. Again, this exercise you can perform lying flat or in a semi-recumbent position as demonstrated by Emma. This depends on the size of your bump. So, without lifting your head, tighten your stomach muscles and your neck muscles and lift your buttocks. Hold for a second. Now relax and gently arch your back. And repeat. Tighten your neck and stomach muscles, lift your buttocks, and relax and gently arch your back. If you're comfortable, you can clench your pelvic floor muscles when you raise your buttocks. So tighten your neck and stomach muscles, lift the buttocks, now clench your pelvic floor muscles, hold for a second, and relax. Repeat this exercise, clenching your pelvic floor muscles, and relax. The next stage is to add a leg lift. Tighten your neck and stomach muscles, lift your buttock, clenching your pelvic floor. Now lift your right leg. Hold it there for a moment and relax. Now on the left side, tighten your neck and stomach muscles, clench the buttocks and your pelvic floor muscles and lift the left leg. Again, hold this for a second and release. Relax and gently arch your back. Now, this is where it gets slightly more complicated. We're going to add on the bilateral leg extensions, which is the first exercise we demonstrated, and we're going to add this to this second exercise. Tighten your neck and stomach muscles, clench the buttocks and your pelvic floor, and lift the right leg. Now, lengthen the leg, shorten the leg. Lengthen the leg, shorten the leg, ensuring that when your leg is extended, your calf turns inwards, and when your leg is retracted, turns outwards. Now release the leg and relax and gently arch your back. Now repeat this with the left leg. Tighten your neck and stomach muscles, clench the buttocks and your pelvic floor muscles and lift the left leg. Now the same principle, lengthen the leg and shorten the leg. Lengthen the leg, shorten the leg. Lengthen the leg, shorten the leg. And relax. And gently arch your back. Repeat this at least 3 times on each side or as much as you find comfortable.
The next next exercise originates from a yoga position. Adopt an all-fours position with your knees wide apart and your feet touching. Next, transfer your weight backwards as far as is comfortable, leaving your hands where they are. It's important to keep your back as straight as possible. Try to avoid overarching your spine. Hold this position for a moment, then come back to the original all-fours position. Repeat this a few times, transferring your weight backwards, holding, and back to the original position. You can repeat this for several minutes if you wish. Now, move your feet apart so they are in line with your hips and your arms are directly underneath your shoulders. From this position, inhale deeply and extend your neck and arch your spine simultaneously so that you end up looking at the ceiling. When you've fully inhaled, now exhale slowly and reverse this motion by tucking your head under and curving your spine. Repeat this with the deep breathing for a minute or so. Inhaling and now exhaling. Ensuring you're curving your spine as much as possible and arching it as much as possible on your way up. Again, you can repeat this for as long as you find comfortable. The next exercise involves maintaining the all-fours position while raising your leg one by one as follows. Starting with your left leg, raise it behind you, extending the leg so it's as straight as possible. As with all of these exercises, don't strain and only complete to a level which is comfortable for you. Hold this briefly, then bring your knee towards your chest. Hold for a moment, then extend it behind you again. Repeat this 3 more times. And place your knee back down to the neutral position. Repeat with the left leg. Understandably, the bigger your bump is, the less you'll be able to retract your knee in towards your chest, and that's fine. Again, just adapt it so it's comfortable for you and your baby.
The final 2 exercises involve adopting the semi-recumbent position. If you are less than 20 weeks pregnant, however, you can do this lying flat, and Emma is going to demonstrate these 2 exercises lying in the flat position. The first exercise is hip stretches. With both your legs flat out in front of you, gently pull your right knee up towards your chest, wrapping your arms around your knee to hold it in place, whilst keeping the left knee straight. Hold this for approximately 15 seconds. This allows time for the stretch to take full effect. And after 15 seconds, release the knee and relax. Repeat this with the left knee, keeping the right leg as straight as possible. Lift the left knee, hold for the 15 seconds, and relax. 3 repetitions of this exercise are recommended for each leg per day for a good stretch. The final exercise is side leg lifts. With your legs straight out in front of you, turn your toes outwards. Now slowly lift your right leg up towards your hip with your knees bent, as demonstrated. It is important you do not lift the leg any higher than hip height. Hold this for 3 seconds and lower the leg. Now repeat with the other leg. That's it. Slowly lift your leg up to your hip, not extending beyond the hip, with your knees bent. Hold this for 3 seconds and relax. Repeat this up to 10 times on the right leg, and then repeat the entire exercise with the left leg. That's 2, 3, 4, 5, and continue. And repeat 10 times on the left side.
We hope you've enjoyed this exercise video. If you build these exercises up in their intensity and duration every day, you should hopefully feel some reduction in your hip pain.
However, if at any point the exercises do become too uncomfortable, you must stop and always seek medical advice if the pain persists.
And remember, any questions or queries, always contact your midwife.
For more information on specifically hip dysplasia in pregnancy, please do seek out our information leaflet and our website.
Thank you very much for watching, and we wish you a very comfortable pregnancy.
Thank you. Goodbye.
Bye.